So let us discuss something very interesting. I had 2 3 cases which I wanted to discuss. That's why I did not keep the topic. Otherwise we keep the topic sometimes anxiety, sometimes fear, and by the time I start the topic, the question starts. So then we cannot discuss those topics in detail. So you can always ask me about anything in between, so that I'll be able to share my cases with you, and after sharing cases I can discuss what basically questions you want to ask. Now there was a very interesting case of a simple case of distension of abdomen. Means the patient came to me that the abdomen is always bloated, and whenever bloating of abdomen comes, there are some medicines which are very very peculiar and very very common in homeopathy. For example, we try to give lycopodium, we try to take carbovage, we try to give China, and these are the medicines we try to give to the patients. Good afternoon, Dr. Bharat, Dr. Bari. So हम बात करते हैं डिस्टेंशन ऑफ abdomen. सबसे मेन बात यह है कि आपको ये पूछना है कि आपको पेट फूला हुआ कब लगता है. See, treating distension of abdomen in allopathy medicine is you can give an antacid, you can give some enzymes like pepsin, like trypsin, like these are the enzymes, or vitamin B12, and the stomach problems get solved till you take the medicines. In homeopathy, it is very important to ask when there is distension. I'll add one thing. एक चीज और ऐड करना चाहूँगा. हमारे पेट में रहता है सेरोटोनिन. Now serotonin is a neurotransmitter which basically is a mood elevator. हमारा मूड को एलिवेट करता है. तो जब भी आपको डिस्टेंशन रहता है, you ask the patient, is he moody, or what has made his mood what you call it, dull, depressed, and that's why there is a problem in distension of abdomen. This is a very interesting fact which I have seen in my practice. Hello, Dr. Babul. A very interesting fact which I have seen in my practice, and I have seen those having distension of abdomen basically suffer from mood swings. If you go to the remedy also, you can have different type of remedy, but every remedy in homeopathy as such has some mental symptoms. That's why you cannot say what is right and what is wrong. For example, you have distension of abdomen because of some grief. Patient comes and tells you that this something happened and I am not able to get out of that. There's a grief. And if there is distension of the abdomen because of grief, because of low serotonin, now you may ask what is the meaning of grief, and grief is a part of life. So if you say what is grief, grief means sorrow, intense sorrow, especially of somebody's death. And if you want to overcome that grief, there's a lot of sorrow and you are not able to overcome that, and the first reaction is in the stomach, there is distension of abdomen. So the only remedy in that rubric is calcarea carb. If you go to the mind symptoms of calcarea carb, walaikum assalam, if you go to mind symptoms of calcarea carb, it helps to elevate the grief, depression, anxiety, sorrow. So calcarea carb becomes a very very important medicine for grief. If you see in stomach distension of abdomen from grief, the only remedy is calcarea carb. Okay, go and read calcarea carb mind symptom. Don't always get fixated, that calcarea carb fair, fatty, flabby. It is there. Go beyond that. Go beyond the other side of Mater Medica. So you will be able to get fantastic results with that. Can you use rubric delusional enlarged body part? No, I have not used this rubric for delusion enlarged body part, because distension and delusion of enlarged body part is something different. Let me take one question. Good afternoon, sir. 55 years male, left nostril obstructed from last 3 months, nose is blocked day and night, and white discharge, very difficult to expel mucus from nose, night time, severe problem, sir. See, whenever you have obstruction of nose, obstruction of hole, and he has rightly said it is left nostrils. So first of all, if you go simple, obstruction of nostrils, right side, very very simple. You have to go very simple. Left side nostril obstruction of. There are 3-4 remedies which are very very important. The first remedy that comes to my mind is synapse nigra. Synapse nigra. Now, if if the disease is from, if the symptom is from 3 months, please take it as a chronic case and then try to get the remedy. So chronic remedy for left side nostril obstruction, you must think about magnesium mure. Magnesium mure is a very, very important remedy if the left side nostril is blocked and the symptoms of magnesium mure. Second, synapse nigra. Third is China Ars. And fourth, you will be surprised, I have seen a lot of cases much better with sepia and nitric acid. These are the 3-4 remedies that come to my mind. Do take your history, do add one or more symptoms, and then you can get the remedy. Sir, kindly tell something to antidote the aggravation of aurum metallicum. Yeah, see, Dr. Nitin, I have worked on this modality of concept of antidoting a medicine, then starting a medicine, or inimical and all. My answer to एक ही चीज याद रखिए डॉक्टर नितिन, your next medicine, if it is a simillimum, it would act as curative also and it would act as antidote also. So this is my answer. The next simillimum in your case is as good as antidote as well as the curative medicine. Simple answer with that. In 30 years of practice, I have seen that. Good evening, Dr. Pushpinder. Good afternoon, Dr. Bilwalkar, Dr. Mishra. Good afternoon, sir. Thank you. So I was talking something about distension. So are we going to go for distension, or there are a lot of other questions? There's a lot of difference between distension and disorder. There's one on my WhatsApp. So, see, if you say this, so I was telling you the concept of serotonin. जब भी आपके, hello Dr. Durva, whenever a patient comes to you with recurrent stomach problem, recurrent distension, make sure to ask the mood. Mood is very important in understanding the distension and stomach disorders. Are you with me? Example I gave you about grief, that is calcarea carb. Now you can say that eating, sometimes when the mood is very bad and we go to hotel and eat one dosa, I said now I'm feeling very happy. So distension of abdomen, पेट फूला हुआ है but फिर भी खाने के बाद अच्छा लग रहा है. Distension of abdomen after eating, the patient is better. Actually what happens, distension of abdomen should be aggravated or the patient should be disordered by eating. But if the patient is better by eating, 2 remedies very, very important in your practice. I have seen lot of cases जब patient बोलता है डॉक्टर साहब मेरा पेट बहुत फूला लग रहा है, after eating I am better. See, this is a contradictory symptom. Distension of the abdomen should be better by fasting, but if the distension of abdomen is better by eating, very, very contradictory symptom. Don't give ignesia because I have used the word contradiction. सभी चीज वहां मत घुसेड़. होम्योपैथी का ये एक बड़ा प्रॉब्लम है. One word and the remedy changes. Distension of abdomen better by eating. Think of ratania. Yes, ratania. You must have never thought ratania, but ratania is the first medicine I give whenever there is distension of abdomen, better by eating. And the second remedy, again very, very rare. Think about Cedron. Cedron दोस्त ऐसी एक दवाई है जो distension of abdomen is better by eating. Are you with me? Hello. उल्टा पेशेंट बोलता है डॉक्टर साहब इतना पेट फूला है, देयर इज सो मच डिस्टेंशन ऑफ abdomen, आई जस्ट कैनॉट ईट एनीथिंग, मैं कुछ भी नहीं खा सकता. देन यू कैन थिंक अबाउट पल्सिटिला माय डियर फ्रेंड्स. आर यू विथ मी? हेलो. सो बोथ आई हैव टोल्ड यू, बट रिमेंबर पेट का प्रॉब्लम सेरोटोनिन इज वेरी, वेरी इंपॉर्टेंट. हेंस in treating irritable bowel syndrome, ulcerative colitis, Crohn's disease, please ask the patient where has the mood gone bad, and the mood because serotonin has been depressed, and then you can prescribe better. Are you with me? This is what I have seen in my 30 years of practice. That's why treating and curing IBS is easy because you have to only ask this mood part. Okay, let us go take one question. 2 years fever and dry cough of 2 years of a child every 15 days. See, whenever you have this, अगर आपको ऐसे कंप्लेंट मिलती है, सबसे पहले आपको कॉन्स्टिट्यूट मेडिसिन राइट होना चाहिए. एक पेशेंट मेरे पास आज ही आया था, जिसको 3 महीने से प्रॉब्लम था सर्दी खांसी बुखार का, like I said, 200 cured the case. So in my, I'll just tell you, give a constitutional medicine. How do you differentiate Lycopus, digitalis, tobacco and cardiac complaints? Okay, I'll get the answer. In Babel, which repertory? I don't know, Dr. Babel. I have gone through Matra Medica, but if it is in the repertory, I normally use complete repertory. So you can go and search for complete repertory. Matra Medica normally, 30 years back, we used to read Matra Medica from books, so we did not have that, the repertory, the programs, and the liberty of repertorizing from the program. So we used to read Matra Medica. So this is what I have read about 30 years back. If it is there in the repertory, it should be in the complete repertory. Okay. So differentiate between Lycopus, digitalis and Tavicum. See, if you have seen my, what we call, if you have seen my videos of cured videos which I am putting lately, I have put one case of, left ventricular ejection fraction, which was very, very less in the patient. If you have seen that, it was, I think, 36, and after the treatment it came down to, it was 23, and after treatment it has come down to 46. Similarly, in Bombay, I have a case where the ejection fraction was 9% of a child of 8 years, and now it is about 40% after treatment. He is under treatment still. Now he is basically in the 10th class. This is very, very important. So if you ask me cardiac symptom, digitalis is very well read. That's a fantastic remedy. But if you see and open Matra Medica and see, Tevacum. Now for this, just one, if you can do, Dr. Vishaka, थोड़ा तंबाकू खा के देखिए, आपको जो भी symptoms आएंगे हार्ट में, that are the symptoms of tobacco. The first symptom of tobacco in any person is either bradycardia or tachycardia, one of the two. Okay. And second, feeling of lot of congestion. Why there is congestion? Because the blood is accumulated there, and because there is a dilatation. So there is acute dilatation caused by violent physical exertion, acute dilatation caused by mental exertion, acute dilation caused by shock. So blood आके जमा हो जाता है, and there is lot of tachycardia or bradycardia and dilatation because there is lot of congestion and angina and precordial pain, and the pain radiates from the from the center of the sternum, and pulse in those type of cases become imperceptible. Okay, are you with me? Are you see, digitalis is well read, so I'll take last. Now you have asked the question about Lycopus. Now Lycopus, if you want to give, remember, I have seen, like, if you say tobacco heart, that is convalescence majors. If you see rapid action of heart of smokers, that becomes, Lycopus. Lycopus means it is written heart's action is forcible and tumultuous, TUMULTOUS, both fast, and palpitation from nervous irritation. Are you with me? And Lycopus is a very important remedy for cardiac asthma like Sumbul. Okay, so in tobacco, if the pulse is imperceptible, in Lycopus, the pulse is rapid and irregular. Okay, so this is the basic, the Matra Medica of these two, and of course digitalis. Now, if you have seen your, Matra Medica, if you've seen the books of physiology, digitalis in homeopathy is called as the heart tonic. Now, digitalis has the active principle digitoxin, which acts on the muscles of the heart. Like Crataegus is a tonic for the arteries because it has action over the crustaceous and calcareous deposits in the arteries. In the same way, digitalis is a very wonderful remedy for, it's a tonic for the heart, especially of the muscles, myocardium. It is that remedy which basically strengthens the heart muscles. Now, if you go detail of heart symptoms of, digitalis, one thing is important, that Because of that, the digitalis patient always desires to take deep breath, because cyanosis is a very important symptom of digitalis. Cyanosis, and in digitalis the most important symptom is the least movement causes violent palpitation. See, because digitalis patient, the muscles are very weak, and when the muscles are weak, if you try to move, you have to use the muscles, and if you use the muscles as they are weak, so it causes violent palpitation. So it is a very, very important remedy for congestive cardiac failure whenever there is a pansystolic murmur. Are you with me? That is digitalis. And that's why digitalis is a very important remedy for cardiomyopathy. When the heart is dilated, hypertrophy of the heart, dilatation of the heart, cardiac dropsy, where the blood accumulates and the pumping is weak, so blood does not come out, so there is accumulation, the patient becomes dull, there is dropsy, the patient cannot walk, the patient cannot climb the stairs of your clinic. If it is on the first floor, he gets panting and he sits down with a lot of perspiration. That is digitalis. Okay, I hope this is okay. Kent, okay, Dr. Babel, I found out. So, okay. Dr. Babel, basically, if you have understood me, you have come to my clinic also. More in relation to, see, if you tell me how do you look at the symptom, which miasm take, which you take mind symptoms or body symptoms or miasm symptoms. Again, I would say go to Organon 6th edition, unperiodized observer. Just when the patient sits in front of you, how does the patient behave, what does he talk, how does he talk, and then automatically start making your symptoms and rubric. Beforehand, don't make it. If I tell you some theme, you will keep the theme in the mind and do the case taking. So you will be you'll be only working on that theme and you will miss all other symptoms. This is my approach in case taking and my practice, which you have seen, and I have shown results in cases from simple cough coryza to brain tumors by using this concept only. Okay. Kindly tell something to cure aggravation of aurum metallicum. As I told you, aurum metallicum, if you see, the next simillimum will either is your antidote also and your curative medicine also. Different affinities from boric, how to use that chapter. Affinities. See, normally what happens, Dr. Meena, I have not used that in my practice. As I was telling in the now case taking, and whatever comes in the case I prescribe. So I would not be able to, I use those, but I'll not be a classical homeopath who has used this only in my practice and then tell the answer. For me, case taking is absolutely unperiodized, whatever the patient comes to me in front of me. Sir, can I do something to cure aggravation? I told you, aurum metallicum. Patients have an electric shock. Now he complains of pain in the wrist. That has got electric. No modalities cannot help. You first give the remedy electricity, rhododendron, phosphorus. This would work. So please tell something to cure aggravation attribute. I have told you, Dr. Nitin. I don't normally antidote or cure aggravation of aurum metallicum. The next medicine you give, you take the history of the patient again, and then give that medicine. That becomes the antidoting medicine also and the curative medicine also. Okay. 60 years, has violent itch until bleeds, whole pricking sensation, no brutalities. She doesn't like to be ventilated by husband, telling her symptom what to do. You can think of sulfur, dolichos, helonius, and calcarea, sulf, natrum, ars, phosphorus. 32 years, male, silent reflux developed in patient IBS after drinking a lot of kada, turmeric during productive viral coryza. Now the patient has gastric cough, sore throat, water brush, but no acidity. The patient has taken a lot of kadas. See, IBS cannot be because of taking a lot of kadas and all, because I've always told you, in stomach symptom, understand why the mood, there's a mood swing, there's a lot of irritation in IBS. So do ask the patient what has caused the patient more irritation in his or her life, and that would be the entry point of IBS case. 50 years, continuous fever, chill and thirstless, discontented. चिली है, थर्स्टलेस है मिश्रा जी, और फीवर है, डिस्कंटेंटमेंट में। आर्सेनिक एल्प 0/5 शुरू कीजिए, फर्क पड़ जाएगा उसको। ऑल्सो कॉन्स्टेंट नीड टू क्लियर द थ्रोट, हॉकिंग द थ्रोट, ये तो बहुत ईजी है। सी वेन एवर यू हैव हॉकिंग प्रॉब्लम, ऑलवेज हॉकिंग, 4-5 मेडिसिन बहुत इंपॉर्टेंट है। कालीबाइक्रोम, नाइट्रम का, फॉस्फोरस, हिपारसल्फ, नक्सोमिका, लैक्टेसिस, अर्जेंटम नाइट्रिकम। अर्जेंटम नाइट्रिक, इफ इन अ केस मुझे कुछ भी नहीं समझ में आ रहा, सिम्टम्स नहीं मिल रहा है, मैं लेट हो गया हूँ, पेशेंट बहुत सारे हैं, तो एक रैंडम प्रिस्क्रिप्शन अर्जेंटम नाइट्रिकम से मुझे पेशेंट्स को फर्क पड़ता है, आप वो ट्राई कर सकते हैं। प्लीज सर टेल सम मेडिसिन फॉर कॉन्स्टिपेशन आफ्टर कोविड। सिंपल डॉक्टर जैन, गिव कोविड 30 फर्स्ट ऑफ ऑल, इफ यू हैव कोविड 30 उसको फर्क पड़ जाएगा। हैव यू यूज बैच फॉर रेमेडीज? मैंने बहुत कम बैच फॉर यूज किया है डॉक्टर साहब, तो मैं इस पर ज्यादा बात नहीं कर पाऊंगा। कुछ कुछ दवा मैं यूज किया हूँ, करना शुरू किया हूँ, तो मैं इस पर अथॉरिटी नहीं हूँ। मुझे कुछ कुछ वेबिनार्स में बोलते बैच फॉर बोलने के लिए, तो जो सिर्फ मैंने ठीक किया मैं वही पार्ट बोलता हूँ बैच फॉर में। ओके डॉक्टर नितिन, अरे मैंने बताया डॉक्टर साहब नितिन कि क्योर एग्रेवेशन ऑफ नाइट्रम, ऐसा कुछ मैंने लाइफ में देखा नहीं है। मैं हमेशा बोलता हूँ आपको डॉक्टर नितिन, ये लिख लीजिए, आपकी नेक्स्ट रेमेडी जो आने वाली है वही क्योरेटिव और वही एंटीडोट मेडिसिन होने वाली है। ओके, तो आगे बढ़ते हैं हम। अभी जो मैं बता रहा था आपको, डिस्टेंशन ऑफ एब्डोमेन, ये सब चीजें इसलिए बताना चाह रहा हूँ, आई एम टेलिंग यू दिस बिकॉज दिस पेशेंट्स विल कम टू यू क्वाइट फ्रीक्वेंटली इन योर प्रैक्टिस। Quite frequently means very frequently. And what happens कि we only use 3-4 medicines, but as I told you, calcarea carb. Okay, calcarea carb, Dr. Yogita Luia. Okay, so calcarea carb, मैंने बताया ग्रीफ के लिए, and I have told you Dr. Barbal, better aggression by eating and better by eating also. This is very very important. Third, I had one patient who came and told me, Dr. Sir, I have done so much work, so much gym, but after doing so much gym and exercise, my stomach is always distended. Now, if you do a lot of gym or exercise, your stomach has to be flat, but this is a ulta symptom, contrary symptom. After doing a lot of exertion, lot of gym, I have distension of abdomen. Very surprising. Again, don't think about always ignitia. Contradictory symptom. What medicines come to your mind after so much exertion, either gym exertion या घर शिफ्ट कर रहे हैं, बहुत वॉकिंग कर ली है, and the patient suffers from distension. Again, this is all because of mood, the mind. So if you study the mind, why the patient has that mood swings, you'll be able to understand that. And the remedy which I gave to the patient was Argentum nitricum. My dear friends, Argentum nitricum. That cured the case. So this is very very important. Understanding why the patient is suffering from distension rather than just giving, blindly carbohydrate, China, lycopodium, and all these gastric medicine which will definitely help but will not cure. Some patient comes and tells us that when I eat fruits, I get distension of abdomen. Very surprising. Again, normally fruits should have a positive effect on the stomach, but it has given a negative effect. The only remedy you should think about is Veratermal. Arthralgia में if you ask me remedies डॉक्टर साहब, तो वही रस्टॉक्स, मैकफॉस, ब्रायोनिया, ग्वाइकम, एरिस्टोलोकिया, एरेनिया डायडाना, sulfur, calcareas, lot of medicines for arthralgia. Abrotenum also, benzoic acid. Sir, can you tell if one person feels fear of eating and drinking in depression? Yeah, it happens, and we have rubrics and medicines also. No desire to eat because of grief, no desire to eat because of stress, no desire to eat because of lot of things, So there are a lot of medicines for that. Hello sir, can you please share some insight to approaching kidney disease patients with complicated stones and heart attack? Yeah, Dr. Yogita. I have a lot of cases of chronic kidney disease where the patients were on dialysis and after the medicine, the patient's dialysis was stopped and he's on homeopathy medicines, though the creatinine is still 3-4, but only on medicines without dialysis, the patient is much better. First answer would be, I always take the whole case and try to get the constitutive medicine right. And in these type of cases, the acute medicines are very important. The patient might gland up in anuria, no urine, uremia, no desire to eat, lot of cough problem, lot of palpitation, weakness. So in these complaints also, you may think a lot of remedies like China, arsenic, sulfur, what do you call, veratrum, then ignitia, natrum, acute medicines. In acute, I use LM potency. In chronic also, if the remedy is right, I do repeat weekly also sometimes. Wonderful results of chronic kidney disease. I have a lot of patients who come to me directly now because of BP, because of sugar, because of a lot of allopathy medicines, painkillers, because of stone. If the kidney is gone bad, we have good results. Just one thing you must remember, Dr. Yogita, if you have case of staghorn calculus, staghorn, the calculus is very big, don't give lot of time in treating, because if staghorn calculus is there, if you have taken a lot of time for treatment, that will damage the parenchyma, damaging the neurons, and the patient lands up in chronic kidney disease, and then you can't operate also because the patient cannot be given anesthesia also. So if you feel the stone is big and the remedy is not working, do refer for surgery, take out the stone, and then you can give the medicine so that recurrent stone does not happen. I hope you understand, Dr. Yogita. Remedy complete aggravation by eating. I did not get the question, Dr. Moon. Sir, kindly name any medicines where person fears eating and drinking. See, whenever you have this problem, fear, please try to find out why is the fear. Please try to find out why is the fear, because if you don't get why there is fear, and fear of eating, fear of drinking, you give medicine, fear of eating, the patient says, I am very happy now, I can eat, but now there is a fear of urinating. Now you give medicine for that, the patient says, this is better now, this has happened. The patient will always keep changing symptom. Always try to get symptoms why the patient is suffering from fear. So fear while eating, you can think about pulsatilla, opium, iodum, gratiola. These are the medicines which I have used, but I would suggest you don't give this medicine. Try to find out the cause of fear and then give medicine. No, there is a symptom where the patient has fear of everything, constant fear of everything. Alzheimer's, pulsatilla, calcarea, lycopodium. Try to find out the reason why the patient is fearful. Okay. I understood. Can you also tell what are the mental cause in such disease? Yeah, Dr. Yogit, I have tried to find out the mental cause, and see, in today's world, in today's homeopathy, there are a lot of themes, themes. But I have seen in my practice, some theme was that there is a lot of fear, anger, and you are not able to take out your anger. Some part of your life, take out the anger, and then the kidney is bad. There is I have not seen those in my practice. That's why I always say unprejudiced observer. Take the history of the patient and try to find out what is syphilitic in that history, and then give the remedy. That would be better rather than going with the theme. Okay. For example, one of the patient came to me of autism, and I told we have to ask the history of the stress of the the pregnancy history, and the patient was not better, and the patient immediately told me, sir, there is a case of my maid who was being raped, and she has a child, she delivered the child, and the child is absolutely healthy, no problem. So after rape, there has to be a lot of stress, but her child is normal. Why my child, you asking? I have no problem. I had no stress of rape is such a big stress, but still the child is okay. So when you go with the themes, sometimes you can falter. So my advice would be unprejudiced case taking, so that you get the symptom by yourself. Then you try to evaluate what is the syphilitic symptom and then prescribe. This is what I do in my practice. Okay, there are a lot of questions which have scrolled up. Okay. Fibroid 42, CPR, Fraxinus americans 3 months. See, of course, I have to take the history also, but Fraxinus americans, if it is not work, there are 3 medicines that you should look for: Felix religiosa, Felix mas, Thalaspi bursa pastoris, and Calcarea flor. Okay. Uh, thank you for so much response. There are so much pending questions which I'll take in the next YouTube live. It's already time up, 30 minutes up. So thank you for joining, and thank you for spending time with me. And I hope you get benefited, and as much as happy I'm sharing my knowledge with you. Thank you so much. Until next Saturday, goodbye.